Hi everyone, today we are talking diapers. The reason we're talking about diapers is because when it gets hot and humid outside, one of the most common reasons I see patients in the office, especially infants and toddlers, are from diaper-related dermatoses or rashes. What happens is the heat and humidity builds up, there's a source of friction from the diapers, and we can see a number of rashes from this reason. So follow along, subscribe now. I am a board-certified dermatologist. I've been in practice for about 20 years. I've raised 3 children, had a lot of diapers in my life, and I can definitely tell you more about not only my experience as both a doctor as well as a dermatologist and as a mom so that you can navigate some of your choices. So before we talk about diapers, let's first talk about how they are constructed so that you can learn all of the sources of interaction between a diaper and the baby's skin so that you can decide which aspect of the diaper you want to focus in deciding on how you decipher between all of the brands out there. Every diaper is going to have the top sheet. That is the portion of the diaper that is in direct contact with the infant's skin. In this diaper, it happens to have a bluish hue, whereas in other diapers, it might not have that bluish hue, and we'll talk a bit about what makes those two things different. The next layer is if you cut open a diaper, and I have one cut open right here. So in the middle of the diaper, and I have one cut open here, you can see there is this absorbent layer. This is made up of what we call super absorbent polymers. These are the absorbent portion of the diaper. This is what makes a lot of diapers vary, is based on how absorbent they are. And this is how diapers have really evolved over the past 2 to 3 decades, from cloth to disposable to now just super absorbent. And the bottom layer of the diaper, this is the outer layer, is going to be the protective layer of the diaper. So that outer layer may look like the top layer, but it's actually a little different in that that layer is going to be a bit more resistant to moisture, trying to protect the clothing for anything that's caught up in that super absorbent layer. And from there, that area is a little bit more perforated to that fabric, just to allow moisture or water vapor to escape, to reduce the buildup between the skin and the diaper. So if you just look at 2 diapers directly and just kind of really decipher what makes them look a little different, I think the first thing that'll stand out between these 2 diapers is that one is all white and one has lots of characters on it, lots of teal and bluish hues, as well as that blue lining on the inside, which this diaper does not have. Now, I actually think that's a significant difference. Diaper manufacturers will state that these dyes are not dispersed dyes. Dispersed dyes are the ones that we link most commonly to contact dermatitis. And they say that these dyes are really in the fabric and that they should not cause any infant skin sensitization. However, there are diapers without them. Now, why are the dyes there in the first place then? So most diaper manufacturers state that the reason for these dyes is based on consumer satisfaction, that many parents seem to favor diapers that might look more like underwear as opposed to just a diaper. However, I will say in practice, even though most companies do state that those dyes are not an issue, when I have patients, not even with diaper rashes, but just infants and toddlers that deal with recurrent cases of just eczema, skin sensitization, I often find that when I recommend one big change, which is just changing to all white diapers without cartoon characters on them, that one step tends to reduce the rate of recurrences in my hands when I've been seeing patients for the past couple of decades. And I think that's a significant reason to consider that if your child is dealing with lots of allergies, skin sensitivities, consider the fact that their body surface area is so small and that this diaper is taking up a significant portion of that body surface area. Once it gets wet with moisture, which it inevitably will because that's its role, is to absorb moisture, then those dyes, it's hard to say if that or some other aspect of the diaper might start to interact with the child's skin and sensitize their skin. So they might not have a true allergy to the diaper, but they might develop a sensitization, which makes them more sensitive to the environment around them. So I think of it as a great source to just eliminate, just in case it's a possibility. Now, if we move on to this top sheet here that's on the inner lining of the diaper, this is an area where some diapers will actually have lotions or ointments pre-embedded in that textile just to reduce the source of friction between the skin and the diaper. Softening that friction or irritation tends to be soothing to the skin and less irritating. This is probably only necessary if you're not using other types of diaper rash creams prior to that, say Vaseline or Aquaphor or other types of barrier types of creams. However, some diapers try to have it built in. It's hard to say what they use because, again, when you look at these packages, they don't always reveal all of those details. So I find if there is any concern that any of those products could be a source of sensitization, that just choosing one without it makes a lot of sense. Next up is fragrances. So it is true that some diapers will have fragrances added to them, and you'll know that because when you do take it out, there's a freshness factor that you smell to it. And what we find with fragrances is most diaper manufacturers will say that the types of products that they use should be less irritating to the infant's skin and pretty not directly in contact with the skin, but deeper in that super absorbent polymer layer. So it should be less likely to cause triggers. But again, if there's any concerns to any sensitivities with regards to fragrances that you noted in other sources, that would be another thing to consider as possibly present within the diaper without you knowing it. Now, in terms of any possibility of any latex or rubber or elastic elements, the main source that you might find that in is the elastic that does surround the thigh. That is meant to just designed to help with the fit of the diaper. Most diaper manufacturers state that they are latex free, but there is still usually a spandex element. However, if you look really closely, it tends to have the fabric stitched around that element, so it should be away from the skin and not necessarily a source of direct irritation for the skin. But it might actually not be the spandex itself that's an issue, but just the source of friction it can create between the skin. Because remember, when it comes to chafing, which would be rashes that you'd see between the diaper and the skin, predominantly along the inner thigh area, along that crease of the thigh, that element of chafing that can present. So there's friction plus moisture that equals a breakdown of skin that can lead to that element of chafing, could be from that lining. If that's the case, then sizing the diaper appropriately might make more sense than necessarily changing the brand, because most diapers will have some sort of element there designed to help with the fit of the product. So going with a larger size is not unreasonable, just to eliminate that source of friction. And of course, putting a barrier cream between the skin and that source of friction can help significantly. Should that source of friction have broken the skin down so significantly as to cause inflammation or irritation, there's a chance the area has been seeded with bacteria or yeast already, and talking to your pediatrician or dermatologist about treatment options for that would make a lot of sense. So I often will get asked, well, what did I use for my kids? And to tell you honestly, I was a poor resident when I had my first child, so I used whatever I could afford at the time. There wasn't that much thought put into the process. My daughter was my second child born, and she was born right after I completed my training, and still cost was a consideration. However, she did have some skin sensitivities, so I did change to all white diapers. This particular brand was not available back then. However, I did find one that was, I think it was 7th generation at the time, and it worked well for her. So I think of your baseline diaper as just one that you buy from the store is never unreasonable to start with, and only focusing on changes to other options should you feel the need to, or if you just know that in your family there tend to be skin sensitivities. Or say, for example, you live in a hot, humid environment and you know there's going to be more moisture, not just from the function of the diaper, but from the environment around you, and you feel like you want to be one step ahead of it, then choosing all white diapers is never a bad idea, because just eliminating sources of potential sensitivities always makes a lot of sense. However, it's not always necessary if you just want to stick with your regular brand names. So let's compare Coterie, a brand that says it has no dyes, and it has its top layer, middle absorbent layer, and outer sheet, along with Pampers, which does have a wetness indicator on the outer layer and inner layer as well too. So we took 8 ounces of water and poured them into each. Both of these are size 4 diapers, and after pouring that water in, you could see that the Coterie really retains its shape, and Pampers really kind of flattens out pretty quickly. The other thing we noted is that the Pampers brand really didn't hold on to moisture quickly enough, and there was some overflow onto the towel behind it that you can see when we lift the diaper up, so there was some leakage there. Of course, this isn't a perfect experiment, but we did try to make this as uniform as possible. What was really interesting though is if you look at this cross section, look at those super absorbent polymers for the Pampers line as being really bulky and crystal-like. versus the Coterie brand is really compact and succinct, which I really thought was really kind of nice about this brand. Now check out this cross section. When you look at the Pampers line, the super absorbent polymer layer really clumps together and pulls away from the top sheet and forms really thick gelatinous crystal-like structures. When I pulled away at the top sheet, you can see that it's somewhat porous and really separates very easily, which makes me worry that some of that moisture can escape through to touch the infant's skin, especially if that diaper is in prolonged contact with the baby's skin. But when you do look over at the Coterie brand, what was really nice about this brand, which I was super surprised about, was that when you look at that crystal layer that's formed by the super absorbent polymers, they really clump together and flatten out nicely and still look like they could absorb some more moisture. But what's really nice is as that layer forms, it doesn't pull away as easily from the top sheet, and the top sheet really did retain its structure. It really did not feel porous. It felt like it was really nice and stable.